Do it. All right. Let's see. Oh, hi everyone. Thank you for stopping in. Thank you for being with us. Hi, Audrey. Hi, Brenda. Hi, Rick. Nice to see you. Well, I can't really see you, but nice to see your name. Thank you all for coming. We're going to give it about one more minute and then we will get started. See, 7 o'clock. We still got people rolling in, but I think for the sake of time, let's get started. Good evening, everybody, and welcome to Medicare. It's Not That Complicated. Brought to you by NAMI, Cook County North Suburban, and Ari Parker, a Medicare expert and author of It's Not That Complicated. I am Bree Hookstra, the program director at NAMI, Cook County North Suburban. NAMI, or the National Alliance on Mental Illness, is the nation's largest grassroots mental health organization, providing public awareness, no-cost support, and education programs online and in person so that people and families affected by mental health conditions can build better lives. We are a lifeline to individuals and families who don't know what to expect in their difficult life journey. We offer classes and support groups and do a lot of local advocacy for mental health. Our programs are completely free and open to those in our 20 community service areas, but we do not turn anybody away who is in need. Our topic tonight will provide further education to better understand the 3 parts of Medicare. Know what Medicare pitfalls exist and how to expertly avoid them. Prepare to make major Medicare decisions, and know more about any costly penalties and how to steer clear of them. According to Medicare.gov, Medicare is the federal health insurance program for people who are 65 or older and certain younger people with disabilities. According to an article written by Christian Worstel on MedicareAdvantage.gov, 25.4%, or approximately 65.6 million U.S. adults are enrolled in Medicare. According to the Commonwealth Fund, about 1 in 4 Medicare beneficiaries live with mental illness conditions, such as depression, anxiety, schizophrenia, bipolar disorder, and more. And 40 to 50% receive treatment. The Commonwealth Fund also states that mental illness is experienced by most of those beneficiaries under the age of 65 who qualify for Medicare via disability. During tonight's webinar, Ari will provide a comprehensive step-by-step plan to further educate us on Medicare before making these important life decisions. Through this presentation, the hope is to lighten the feelings of anxiety and stress when thinking about planning for your financial future. We will leave plenty of time for Q&A at the end. If you would like to type your questions in the chat box during our conversation, please do. Tonight's guest speaker, Ari Parker, is an expert on demystifying Medicare and an advocate for mental health support. Ari is the co-founder and head of Medicare Advisory at Chapter, a company dedicated to guiding people through important healthcare decisions. He leads a nationwide team of 100+ licensed Medicare advisors who have helped thousands of Americans gain confidence in navigating Medicare. Ari started his career in education by teaching constitutional law and civil rights to high school students. He later obtained his law degree from Stanford University. After law school, Ari worked as a public defender with an emphasis on creating divisionary programs for people struggling with mental illness. Through that experience, he realized that he could make an even greater impact by working outside the system to change how people experience it. Through his professional journey, Ari has been passionate about expanding healthcare access and supporting mental health. His mother has been an active part of NAMI for several years, where she put together a team for the NAMI walk each year. Woo, go mom. Ari provides resources and advice to organizations like ours because he believes no one should feel lost when making decisions about their care. Ari is also an author of the Amazon best-selling book, It's Not That Complicated, which breaks down Medicare into simple, actionable steps. His writing has been featured in major media outlets like the New York Times and Wall Street Journal. We are very honored to have Ari share his personal Medicare experience, extensive knowledge, and compassionate approach with us today. I know you will find his presentation insightful and empowering, so I am honored to welcome our guest tonight, Ari Parker. Thank you, Ari.
Thank you so much for that introduction, Bree, and hi, Mom. So let me share my screen. Great. I am honored to be with you. I am a member of NAMI. My mom is a member of NAMI, and it is just so great to present to y'all tonight. I've been looking forward to it all week. I have a little presentation for you, but if you have any questions along the way, please reach out at connect@askchapter.com. Connect@askchapter.com. Happy to answer any questions you have from the presentation by email. Or you can call us, and our number is 855-900-2427. So that introduction was amazing. I'm so grateful for Bree for inviting me to speak to you tonight. If you'd like a copy, I wrote a short book on Medicare, and I'd be happy to send it to you. Just send me an email at connect@askchapter.com, and I'll put it in the mail for you. But this is really a synopsis of the book. It's a short presentation on what I write about, and it's not that complicated. So I want to go over the key components to Medicare. You can picture it as a three-legged stool. You need all three legs of the stool in order to have comprehensive coverage. That is hospital, what happens if you're inpatient, that means you have a wristband. Outpatient, everything that's outside the hospital. And then finally, drug coverage. You need all three legs in order to support you in choosing your health plan. Now, let's break this down a little further. Part A and Part B are the first two legs of the stool. Part A is hospital coverage. Part B is medical coverage. You get these parts directly from the government. They come straight from Uncle Sam. It's known as Original Medicare. Part A covers you when you're inpatient. It also covers you when you're at a mental health care facility, when you're at a skilled nursing facility, when you have home health care, or when you're in hospice. Now, if you're curious about how this is paid for, you've probably paid for Medicare Part A by way of federal payroll tax. If you or your spouse have worked for at least 10 years, then you have premium-free Part A. You won't owe anything to the government for your hospital coverage. Then there's Part B. Part B is medical coverage. This is outpatient. This covers visits to the doctor, visits to specialists, lab work, X-rays, MRIs, CT scans, even durable medical equipment is covered under Medicare Part B. There's a charge for it. Most Americans pay $164.90 per month for Medicare Part B. Now, if you're wondering what next year's amount will be, it hasn't been announced yet, but the projection is that it'll go up to about $175 per month. And if you're wondering when it'll be announced, it'll probably be in the next 2 or 3 weeks. You owe this amount directly to the government, and you have to pay it each month, or else you'll lose your Medicare Part B. Your health insurance will be canceled due to non-payment. So it's really important to make sure that you set up Medicare Easy Pay so that you can easily give the government its share for your Medicare Part B. With that, here's a picture of your red, white, and blue card. As you can see, if you start Medicare by way of turning 65, and don't worry, I'll cover what that means in a moment, then your Part A and your Part B date will match. If you wait to apply to enroll in Medicare, then your Part B date will probably be a little later than your Part A date, and that's totally normal. So just know that if you're applying for Medicare by way of 65, then normally your Part A and Part B date will match. If you're applying after 65 because you're on yours or your spouse's work coverage, then your Part B date might be a little later on. What does Medicare not cover? There's two big ticket items. The first is that in return for that $165 roughly that you give to the government, you get 80/20 coinsurance. So that means the government picks up 80% of your doctor's visits, your knee replacement, which my mom just had, an elbow break, which my mom also had. And then she would have owed 20% out of pocket had she not had some type of additional coverage. I'm just giving you a hard time, Mom. But there's no cap on what that 20% could amount to. So, for example, if the knee replacement costs $40,000 and then the visit to the hospital for your elbow costs $1,600, then you owe that amount to the government. You owe 20%, you owe that 20%. You would owe $8,000 for the knee replacement plus $400 for anything related to the elbow, because that would be your 20% cost share. And that amount would just keep going up, and there's no cap on it. The second big ticket item that Medicare doesn't cover, that is original Medicare, is long-term care. Currently, there's no coverage for long-term care under original Medicare. You hear long-term care referred to by other names like nursing care, around-the-clock care. These are all synonymous terms for the same concept, which is 24/7 care. Now, nursing care is defined by the activities of daily living, like eating, bathing, dressing oneself. Even cognitive decline is covered under long-term care, but currently there's no coverage under original Medicare for long-term care. So I just want everyone to be aware of that. There have been proposals in Congress. None of them have made it out of committee. It would simply be too costly to insure seniors for long-term care under Medicare. So I don't expect any changes to that in the near future. So the big question I leave you with tonight, and it's something that you can answer as soon as the open enrollment period, which begins October 15th, is how will you cover the 20% that original Medicare doesn't cover? Remember, original Medicare still leaves you with 20% cost share responsibility. You owe that other 20% out of pocket, and sky is the limit on what that could amount to. So when people realize that original Medicare won't cover all of their healthcare costs, it's typically when they reach out to us and me and my team for guidance on how to insure against the other 20%. So with that, I want to walk through the 7 most common mistakes I see our clients make. To avoid these mistakes, please feel free to email connect@askchapter.com or to give us a call. You can also visit our website, because I really want to make sure that you don't make these same mistakes. And I'm going to go over what those mistakes are, but I'm also going to give you practical advice for how to avoid them. And if you have made these mistakes, then there's no time like the present in order to get them handled. So the first mistake we see is that Medicare begins automatically when you turn 65. This is only the case if you're taking Social Security. So for someone who's turning 65 and isn't taking Social Security, you have a 7-month initial enrollment period that begins 3 months before the month in which you turn 65. Then it goes your birth month, and then the 3 months after your birth month. So for example, not to date my mom, but her birthday is January 21st. Her window to sign up for Medicare begins October 1st. If she signs up for October, she'll receive a red, white, and blue card that has a January 1st effective date for Part A and Part B. If she waits until January to apply, then her Part B will begin in February. And if she waits until April, which would be the latest month in which she could apply, then her Medicare would begin May 1st, but her hospital coverage would still be dated to January 1st. Feel free to ask any questions on when your initial enrollment period would be, but know that we're here to help you. We're entirely free of charge to use. So absolutely feel free to reach out to us if you have any questions about when you ought to start Medicare. It's something we help clients with every day. The next consideration is if you're past age 65 and you're still working, or you're on your spouse's coverage, then when can you start Medicare? Well, this will give you a special enrollment period as long as yours or your spouse's coverage has 20 or more employees. So if you work for an employer that has 19 or fewer employees, or for example, if you're a solo practitioner or you own your own company, then you need to start Medicare by way of turning 65. Because a special enrollment period wouldn't apply to your circumstances because your employer or your group insurance doesn't have 20 or more employees. So just know that if you want to delay Medicare, that's okay, but you must work for an employer or be part of a group that has 20 or more employees. There's also a special note I should mention here that if you have a health savings account, and health savings accounts are amazing, I contribute to one myself because they're triple tax advantaged, then there's going to be special timing that goes into your consideration on when to start Medicare, because your Part A will be backdated 6 months if you're past age 65. What are the rules for applying for Medicare by way of special enrollment period? Well, you have an 8-month window that begins 3 months before the month in which you retire, and it extends 8 months out. So it's really an 11-month window, beginning 3 months before the month in which you intend to retire and extending 8 months out. But you don't want to wait, because if you wait until you actually retired, then you're going to have a gap in your coverage. And you don't want a gap. That means you have no health coverage at all. So typically people reach out at least a month before they intend to retire so that we can give them the forms on how to apply to enroll in Medicare. And it takes less than 5 minutes to apply if you do it online. Don't call Social Security to apply to enroll in Medicare. You're going to wait on hold for at least an hour. It's an awful experience, and they won't help you apply over the phone. The best way to apply is by applying online, and I'm happy to share the instructions with you if you reach out through connect@askchapter.com. The second mistake we see our clients make is not realizing that it matters when you sign up for Medicare. There is a timing aspect here. Here are the penalties if you enroll too late, if you miss your enrollment period. There's a 10% penalty on top of your Part B premium, and it compounds. It goes up 10% for every full 12 months that you wait to apply. There's also a second penalty related to drug coverage. And that penalty actually begins 63 days after you were supposed to enroll in Medicare Part D. And it just continues to grow. And you owe both of these penalties for the rest of your life. So even if you're a year away from Medicare, it's not too early to start the conversation about when your window to apply will be to make sure that you avoid these penalties. And just by virtue of attending tonight's presentation, you're in great shape in order to avoid them. But you don't want to get stuck with these penalties. As you can see, they continue to compound, and they're lifetime penalties. You owe them for eternity. The third mistake we see is, remember when I said that Medicare costs $164.90 for most Americans? Well, some Americans earn more and they pay more for Medicare. Let me go through what the Medicare high earner tax is. There are actually 2 surcharges related to Medicare. There's a surcharge on Medicare Part B, and there's a surcharge on Medicare Part D. And you owe these amounts if you file solo and earn more than $97,000 per year, or if you file jointly and earn more than $194,000 per year. And don't worry about deciphering this one-pager. I'm happy to send it to you because you attended tonight's presentation, and then you can see which bracket you might fall into. So when I say $97,000 or $194,000, what is that looking at? It's a 2-year look back. So for this year, the government is using your 2021 tax return in order to calculate whether you owe a surcharge on your Medicare Part B and Medicare Part D. So it's a 2-year look back. 2023 is based on tax year 2021. If you've had a change in circumstances, for example, if you've had a work stoppage, a work reduction, if you've gotten divorced or you've gotten married, then those are all valid reasons to appeal your high earner tax. And this is something our team helps people with every day. There's no charge. And it's a simple form that you fill out, send to the Social Security Administration, and then you hear back within 4 to 6 weeks whether your appeal has succeeded or not. So you're just asking the government to instead use tax year 2022 or even your anticipated earnings based on this year in order to appeal your high earner tax. Another name for high earner tax is income related monthly adjustment amount, or IRMA. I don't know why the government comes up with these acronyms, but the government loves acronyms. So these are all synonymous terms: Medicare high earner tax, income related monthly adjustment amount, and IRMA. They're all describing the same things, which is someone who earns more than $97,000 and files solo, or someone who files jointly and earns more than $194,000. The fourth mistake we see people make is assuming that original Medicare, that is Part A and Part B, cover all of your costs. You know it doesn't. It only covers 80% of your costs. So how do you get coverage for the other 20%? Well, there's only 2 options. That's the good news. One option is to keep original Medicare and add Medigap. Medigap is also known as Medicare Supplement. And if you go this route, then it would cover the 20% of expenses you would otherwise owe. I'm going to unpack that a little further in the next slide. What I want you to remember here is if you do choose Medigap, then you need to add a standalone Part D prescription plan, or else you're going to be subject to the Part D late enrollment penalty unless you have some type of other creditable drug coverage. The second option is what you see advertised on television. You see Joe Namath, William Shatner, Jimmy Walker. You could name your favorite Medicare Advantage spokesperson. They're all describing this type of plan, which is a replacement for original Medicare. It limits your choice of doctor, it limits your flexibility, but it does come with some benefits, and it's called Medicare Advantage. It's also known as Part C or an all-in-one plan. You see these heavily advertised, especially right now, because we're approaching the Medicare open enrollment period. What these plans do is replace original Medicare through a private insurance company's network of doctors. It must be at least as good as what original Medicare would have provided, but it does come with managed care restrictions, and it is subject to prior authorization. If you want to choose the lowest cost plan, then Medicare Advantage might be for you. But if you want to maximize flexibility and choice of doctor, then I would strongly encourage you to think about the trade-offs involved with going with Medicare Advantage. Though it does offer additional benefits like prescription coverage bundled in, dental, vision, hearing, even transportation, the managed care restrictions can really be a trade-off that prevent people from choosing this option. And we help clients with both options. What we do is we search across your providers, that is the doctors you see, your prescriptions, the drugs that you take, and then finally your priorities, what's important to you. If you have grandchildren that live in a different state, then you probably want flexible coverage that'll work nationwide. And so on that note, one type of Medigap plan, the most comprehensive type for someone turning 65, is Medigap Plan G. Medigap Plan G. So remember, original Medicare refers to parts. The additional coverage, whether it's Medigap or Medicare Advantage, refers to plans. So Medigap Plan G is a type of Medicare supplement, and it's the most comprehensive option for someone who's turning 65 right now. What it has is no network restrictions. You can see any doctor nationwide who accepts original Medicare, and almost every doctor does. You don't need permission from your primary care doctor in order to see a specialist. For example, if you want to get a second opinion on a cancer diagnosis at MD Anderson in Houston, you're free to travel from Northbrook to Houston for that second opinion. You don't need to ask anyone for permission. Same thing with coming to the Mayo Clinic in Scottsdale or going to the Cleveland Clinic in Ohio. You won't see any additional bills or copays after you meet your Part B deductible. What's your Part B deductible? It's only $226. If you compare that to the work coverage I have, my deductible is $2,000. $226 is a bargain, and you won't see any Medicare approved expenses thereafter. And again, it works nationwide, and it also includes 80% international coverage for the first 60 days you're outside the United States, subject to a $50,000 lifetime limit, which goes exceptionally far anywhere but the United States. Can really, I've seen hospital bills, even in Western European countries like France or Germany, that are way more affordable than the bills I see here in the States. So this is one type of Medigap plan. If you're going the Medigap route, I would strongly encourage you to think about Plan G, because that's the Cadillac of Medigap plans. Just remember, you need to add a standalone Part D prescription plan, because original Medicare doesn't cover your prescriptions, and Medigap sits on top of original Medicare. All right, that brings us, it's a nice segue, to mistake number 5, which is that choosing drug coverage isn't important if you don't take expensive prescriptions. I recommend I recommend that even people who don't take any medications at all sign up for a prescription drug plan. The reason why is because of the Part D late enrollment penalty. So even if you don't take any prescriptions now, it only costs 2 to 3 cups of coffee per month to sign up for the lowest cost drug plan. And then you have insurance for the rest of the year, and it avoids the Part D late enrollment penalty. There's 2 ways to get Part D coverage. The first is through a standalone prescription drug plan. The second way is as part of a Medicare Advantage plan. So those are the 2 ways to get it. And again, we save members $1,100 per year just by reviewing their drugs. There is a legislative change going into effect that I'm going to mention in the Q&A, but I just want to say it's really important to review your drug coverage every year, and it only takes about 15 minutes to do it. And our team would be happy to help because we're the only company that has a platform of every single plan option that's available to you, whether you live in Cook County, Maricopa County, or Broward County. The sixth misconception we see is that your neighbor's plan is a good choice. Well, do you see the same doctors as your neighbor? Do you take the same medications as your neighbor? Do you enjoy the same travel arrangements as your neighbor? Maybe your neighbor doesn't like to travel as much as you do. Well, then your 3 Ps, your doctors, your drugs, and your priorities are different than your neighbors. And you should probably consider other plan options than what they might be on. So even if your neighbor is in love with their specific Medicare Advantage plan, it might be good for you to consider all the other plans that are out there. For example, in Cook County alone, there are 53 Medicare Advantage plans, and the right plan for you is going to depend based on your providers, your prescriptions, and your priorities, what's important to you. The final misconception, and couldn't be more timely, is you only need to choose your coverage once. It's something that you should do each and every year. Each and every year, you should review what is changing about your plan, because the plans do change every year, and you should review whether your circumstances have changed. It's good to do this with an independent, unbiased advisor because it's free to use one. And just note that the time to do it is coming up. It's coming up. It is the annual enrollment period, which is October 15th to December 7th. So that's why you're seeing all the commercials. That's the time in which you can review your coverage for 2024. Now, you might ask, what if I'm on a Medigap plan? Do I need to review that? You probably don't. My saying is marry your Medigap, date your drug plan, or your Advantage plan. So if you're on your Medigap plan, all you need to do is keep paying your premiums. It's still good to review your drug coverage every year. If you're on a Medicare Advantage plan, you need to review it every single year, because what you're receiving in the mail right now is the annual notice of change, the ANOC, which describes how your plan is going to change for the upcoming year. But maybe your priorities have changed. For example, if you've developed a chronic condition and there are now diabetes specialists that you need to see, then it would be important to find a plan that works well with those doctors for the upcoming year. So marry your Medigap, date your drug or Advantage plan is an easy way to remember and avoid this mistake. With that, I want to go through a few questions that our attendees sent in advance. The first is, I'm past age 65 and planning to continue working for at least another 2 to 3 years. Do I need to enroll in Medicare Part B? This goes to the size of your employer. If your employer or your spouse's employer has 20 or more employees, then you don't need to take Medicare Part B. But you can sign up for it at any time and drop yours or your spouse's work coverage. Then you would receive a special enrollment period to start Medicare Part B. It's important to do a cost analysis here. If you don't like your work coverage, then it might be a very good decision to start Medicare, because what people don't realize is Medicare is excellent health insurance. It's the closest thing this country has to good universal coverage. But many people think that because it comes from the government, it's subpar in some way. But in fact, it works a lot better than many people's employer plans, and it costs less because your work plan probably has a deductible that's several $1,000s. And that's especially true if you're on a high deductible plan. Compare that to your deductible with Medicare. The Part B deductible for this year is only $226. So do a cost comparison and see which one is right for you. And this is something that I talk about, and it's not that complicated. The second question is, if I have a pre-existing condition, can I be denied for a Medigap plan? And the answer is yes in Illinois. In the state of Illinois, you have a 6-month window when you start Medicare Part B to sign up for a Medigap plan, for example, a Plan G. If you're in your Medigap open enrollment period, which is the 6 months after you start Part B, then you can't be denied based on a pre-existing condition, a chronic illness, and you can't be charged a different amount. If you wait past that 6-month window and you don't have a guaranteed issue right, which are pretty rare, then you will be subject to questions about your health history. And the carrier can, and oftentimes will, decline you, just, for example, for having been hospitalized for COVID within the past 2 years, or if you have a knee replacement coming up, or if you have any issue with your heart, with diabetes, with your lung, kidney, the list goes on. So it's really important, if you know you want to go Medigap, to sign up during your Medigap open enrollment period. And I know this can be a little confusing, but your Medigap open enrollment period is very different than the annual enrollment period that's coming up. Just because the annual enrollment period is happening doesn't mean that you can switch to a Medigap plan in the state of Illinois. If you're already on Medicare, then you would likely need to answer questions about your health history if you're outside the 6 months after starting Medicare Part B. What about other states? Well, 45 states are just like Illinois. There are 46 states in total that have this rule about a Medigap open enrollment period. If you live in New York, Connecticut, Massachusetts, or Maine, then there's year-round guaranteed issue in those states for Medigap. But just note, if you don't live in one of those states, and most of tonight's attendees don't, then take advantage of your Medigap open enrollment period, which starts 6 months after starting Medicare Part B. You might be wondering, Ari, why isn't this mentioned more? Like, where's the advertising about Medigap? Well, Medigap isn't really advertised. It's not. You might receive some direct mailers about it, but compared to Medicare Advantage and the commercials that you see on television and radio, Medigap just isn't that talked about. So it's important to do your research, and just by attending tonight's presentation, you're already in great shape. The final question is, I've been hearing a lot about changes to Medicare Part D. What's going on? I love this question. There's a once-in-a-generation change that's going into effect on Medicare Part D and that I write about in the book. And if you have the book handy, it's pages 58 and 59. What's happening with Medicare Part D is a maximum out-of-pocket cap is going into effect for 2024. It's going to be roughly $3,333. Compare that to this year. This year, there was no maximum out-of-pocket cap on Medicare Part D. There were seniors that paid $15,000 for their medications as a result. Next year, that's changing. So it's important that you review your coverage for the upcoming year to take advantage of those legislative changes. There's also more good news on the way. In 2025, the maximum out-of-pocket cap is lowering from roughly $3,300 to $2,000. So really good news is in store on the drug coverage front. What about Medicare price negotiations? That's been in the news a lot. Well, those won't take effect for several years. It's still a few years off, but we'll see how that shakes out as well. All right, let's go to the Q&A. Rick asks, I'm helping my mom with this. She just moved. So does she need to reapply in her new state? It depends on the type of coverage that she has, Rick. It would be good to do a review if your mom is moving. And yeah, I would definitely take this offline so that we can go through your mom's 3 Ps, the doctor she sees, the drugs she takes, and what's important to her to make sure she has the optimal coverage in her new place. But congratulations on the move. That's really exciting. Yeah, Maria asks, Maria, great question. Let me go back to that. So Maria's asking about Medigap. And she's asking specifically about the 80% international coverage. Original Medicare does not have international coverage, but Medigap does. 3 plan types specifically have international coverage. And Plan G, Plan F, and Plan N, which are by far the most common types of Medigap plan, have this international coverage benefit. So even though it's not part of original Medicare, it would be part of your Medigap insurance if you choose the appropriate plan letter type. And Medigap is standardized under federal law. So one carrier's Plan G doesn't differ on the hospital and medical benefits that it offers or the international coverage benefit from any other carriers. So they're mainly competing on price. So it's really important to choose the lowest cost plan up front so that you don't overpay over time for the same exact thing. Jack asks, what about someone with a disability under 65? How can I find out how to get Medicare for them? Great question, Jack. So here's the rules for disability for how to get Medicare by way of disability. First, it has to be for someone who's on SSDI, not SSI, but SSDI. If a person has been taking SSDI for 24 months, then they are eligible for Medicare in the 25th month. So their Medicare will be dated to the 25th month of taking SSDI. That's how you get Medicare by way of disability. And Rick, yes, we do help with Medicaid for someone who is dual eligible. That means they're both Medicare eligible and Medicaid eligible. And we even help people with redetermination, which is going on nationwide right now, because under the public health emergency, states weren't allowed to purge their Medicaid rolls, but unfortunately now they are. So a lot of people are receiving notice that they're losing their Medicaid, even though they're eligible, and we help them reapply. Chris is asking about his Illinois state pension. It would be good to check with your benefit administrator on the drug coverage that's associated with your state pension. A lot of the state retiree plans that I've examined definitely have drug coverage, so you should be good there, Chris. All right. Any more questions? I'm here. So Margaret's asking about the penalty part of Medicare. Margaret, it's not something to worry about as long as you apply timely for Medicare. So if you're not in your initial enrollment period or in your special or you still have creditable work coverage, even though you're past age 65, meaning you or your spouse work for an employer with 20 or more employees, then you're okay. But it is something, even if you're a few years away from Medicare, feel free to reach out so that we can work on the timeline. James is asking about withholding Medicare premiums. Yes, if you are taking Social Security, then Medicare deducts your Medicare premium automatically. And then Maria asks, great question, how is Chapter different from a SHIP? SHIPs are great. SHIPs are volunteer organizations that help people with information about Medicare. What a SHIP can't do is get into the nuts and bolts, though, of what plan is right for you, because that's going to vary based on your 3 Ps, your providers, your prescriptions, and your priorities. And only working with an independent, unbiased advisor that has access to every single plan option available to you will be the way to sort what plan is right. Because remember, getting information about original Medicare is awesome. It's a great starting point. But then there's the question of how will you cover the 20% that original Medicare doesn't cover? And there you only have 2 plan types, Medigap or Medicare Advantage. Oh, wow. The questions are coming in. I love this. So Carla, if your dad is turning 65 at the end of February, now is a great time to start the planning process. And just this is amazing that you're doing this on behalf of your dad. And I just really want to help you. The initial enrollment period for your dad will begin November 1st, but know that it's not too early to continue to get resources for him. And I would probably make an appointment to speak with an advisor so that you can get everything set up for dad so he's ready to hit the ground running on February 1st, which is when his Medicare Part A and Part B will begin. And just by virtue of attending this presentation, you're definitely going to help your dad avoid those late enrollment penalties. Andy asks, if one moves outside of Illinois, can they keep their Medigap or Medicare Advantage plan? You can absolutely keep your Medicare, you can absolutely keep your Medigap plan if you move outside the state of Illinois. It's portable. On your Medicare Advantage plan, that probably isn't, because it's restricted to a 50-mile radius from where you live. So if you move outside of Illinois, then there's probably going to be new plan options available to you, and you would want to search amongst them to find the one that's right for you. And Melanie asks about Medicare savings. That's great. Medicare savings is Medicaid, and this is a way for people who are struggling to pay their Part B premiums to get help from the government. in cost sharing on their Medicare Part B premium, and also any expenses that they have related to their healthcare. So we help people with this all the time with the Medicare Savings Program. And just know you can have both Medicare and Medicaid. We work with these types of clients all the time, and even help them get their Medicaid restarted if they were taken off when the public health emergency ended in May. Oh, Judith is asking for our web URL, and our web URL is the email address is connect@askchapter.com. Connect@askchapter.com. And I'm going to type the answer here. And I hope everyone can see that. And Bree, thank you for putting a link. Bree, in response to Rick, put a link in order to book an appointment with our team. I'm also our lead trainer. I train our team of 50 plus Medicare advisors, and I'm going to make sure that you have a great experience with us. Maria asked, does Chapter charge a fee? We don't. We're entirely free to you. You might be wondering, how do you get paid then? We earn revenue from insurance companies, and it doesn't matter which company you choose. Genevieve asks, if I take a job, I hope I'm pronouncing your name right. If I take a job while on Medicare, can I decline the health insurance plan offered by my employer without penalty? Absolutely. Great question. Yes. Yes, you can. And for many people, this makes a lot of sense, especially if they're working part-time and have ridiculous cost sharing under their part-time arrangement. Oh, Rick, I don't think I'm picking on my mom. I pick on her a lot more outside of presentations. I'm trying to be nice. All right. We are winding down. No, Avita, the high earner premium doesn't stick with you for life. It's a 2-year look back. So for this year, it's based on your 2021 tax return. And for next year, it's going to be based on your 2022 tax return. The link is either will work, whether you use askchapter.com or askchapter.org. But do know that our website is askchapter.org. Askchapter.org is our website. Yeah, Judith asked a great question, which is how to appeal IRMA. First, send an email, because this is something that we can help you get sorted. Know that anything we do today wouldn't go into effect, they won't look at previous payments owed. It'll just affect what you might owe for October, November, and December, because we're already in September. There is no time limit on applying, but just know that it's only going to work going forward. It's not going to work on getting any money reimbursed from the government. But there's still time to work on next year. So if 2022 was a really good year and your circumstances have changed this year or will be changing next year, you anticipate they'll be changing, then December is a great time in order to appeal your high earner tax so that you take full advantage of getting savings for the upcoming year. And Mary asks, this is a great question. I'm not paying anything for coverage with Medicaid, but will that change with Medicare? No, you won't have any cost sharing responsibilities. You are required to start Medicare, though. Just be aware, if you're on Medicaid, you are required to start Medicare because they work together to take care of your healthcare costs.
Are there any more questions from our audience? Give it a couple more seconds. Thank you so much, Ari. We really appreciate you coming and providing us with this information. Wonderful. Thank you.
Thanks so much.
Yeah, totally. Okay, well, it looks like those are all of the questions that I see. If you do have a question later on, and maybe you just sleep on it, think about it, and you have a question, I will put my email in the chat when we are getting ready to go. Please feel free to email me, and then I can, Ari, hopefully shoot them over to you. Awesome. And then if you or a loved one does need to rewatch this, we do record our webinars. We post them on our YouTube channel. So give it about 1 to 2 weeks, and this presentation should be posted on the YouTube. So thank you again, Ari. We really appreciate you coming, and I do want to provide some information from our end. So if you did enjoy tonight's presentation, you can find more information about upcoming events and upcoming programs on our website at www.namiccns.org. Our next program will be held on October 25th from 7 o'clock to 8:30, where Dr. Steve Best will provide information on resistant neuropsychiatric illness. That's a mouthful. Also, if you are interested in getting involved, please register for our annual 5K. Hopefully, Ari, we see your mom there. It is taking place on October 7th. There is more information on our website as well. Registration is on there, so please come out. We would love to see you and to support a great cause. Also, once you log off, there will be a short survey. Please, 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 please take the survey, as we use those numbers for grant writing, for fundraising, and also to see if we need to improve our programs moving forward. We take your feedback into high consideration. So please, please, please fill that out. All right. We appreciate your presence tonight, and we look forward to seeing you again at a NAMI CCNS community webinar. Please take care of yourselves and each other. Bye. Thank you, Ari.
Yeah, of
Appreciate
course.
you.
It was a pleasure.
I will send
Thank
you some numbers soon.
Sounds good.
Awesome.
Have a
Bye.
great night, everyone.
You too.